Well, when something isn't right with your heart, it causes panic, and rightfully so. One thing that is fairly common, rapid heartbeat, and it can be caused by many things. This morning, our daytime cardiologist, Dr. Shoba, is here with more on the topic, and always good to have you back on the show.
Good to be here this morning.
Busy time of year, obviously, as we get ready and head into the holidays.
It was so good to see you both talking about Thanksgiving. For a minute, I just completely forgot about all the illness and ailments out there. You know, it is so important to keep celebrating the festivals, because otherwise, you know, that is what we live for, is, you know, for each other. But so important to be careful around these times of gatherings, you know, still sort of maintain your social distancing if you can, you know, the masks and the hand sanitizing and all that, and be careful with the number of people in the room. So important to celebrate, but time to be cautious while celebrating.
Absolutely. We talk about counting our blessings and being grateful, and the last thing anybody would want to do is be harmful and spread those germs that we don't even know that we have.
That's right.
So, and of course, too, you were talking about one thing that happens a lot, and as we get more stressful, ending the time of the year, and then with the politics and the pandemic and stress, hearts can really be knocked out of rhythm.
Oh, that is so common. And we are seeing so many people with heart rhythm issues lately, and for all the reasons that you mentioned. You know, there are so many different types of rhythm problems. You know, there's skip beats coming from the upper chamber, from the lower chamber, that are very common. And there's also a condition called atrial fibrillation. And since the rhythm problems are so many, I thought, you know, we might focus on atrial fibrillation. For the simple reason is, when I was on call yesterday, I had 4 people come in with the same diagnosis into the hospital. And some of them didn't even know that they had that condition.
You said some of them were actually just used to it and just thought everything was fine. That was just part of getting older, or maybe not being so healthy.
That's correct. And you know, women especially tend to blow off their symptoms. Oh, I'm just getting old. You know, my weight has gone up, and that's why I'm feeling tired and fatigued. You know, they tend to self-blame when there's actually a hidden medical condition. And so important to realize, you know, there could be something really wrong with you if you're not feeling good. So important to listen to your body.
So then when they come in, what do you do for that? Because you said sometimes it can be okay, it's a one-time thing, but other times it can be a symptom of something bigger.
You know, atrial fibrillation is a condition where normally the upper chamber squeezes and the lower chamber squeezes in sync. In atrial fibrillation, the upper chamber sort of jiggles around like this, and it never squishes properly. So the lower chamber just tries to keep up with it. Very, very erratic, rapid heart rate, and that can cause fatigue, tiredness, shortness of breath, and you may not even feel palpitations. But the one danger, big danger of atrial fibrillation is, since the upper chamber does not squeeze, the blood just sits there and it can form clots, and that clot can go up into your brain and cause a stroke. So atrial fibrillation is a very important hidden cause for stroke. So if you don't have any blocked arteries in your neck and we find stroke, we actually look for atrial fibrillation proactively. Another more important thing of atrial fibrillation is it can cause congestive heart failure. And atrial fibrillation can be a marker of something else going on in your heart, like, you know, your heart not getting enough circulation.
So what happens when that patient comes in? Are there certain tests that you do?
Yes, you know, a simple test that can tell us is an EKG.
Okay.
And sometimes, you know, those people that have a blood pressure machine at home, if you find that that little blinking thing is very, very erratic, that could tip you off that you're having some rhythm issues. They are not 100% accurate, but that could be a tip-off. If you're not feeling good and that blinking thing on your blood pressure monitor is a little erratic, it might tip you off that something is not quite right in your heart. And also remember, thyroid issues and sleep apnea are very common in Tri-Cities. I don't know why we have both sleep apnea and thyroid trouble and high blood pressure are important causes of atrial fibrillation. So if your blood pressure is going up and down, your blood sugars are going up and down, you have sleep apnea where you don't get enough sleep oxygen at night, or you have thyroid is bouncing up and down, that can also cause atrial fibrillation.
So it sounds like it's best if you have some of this and this is a pattern, you should probably get it checked out.
Correct. And oftentimes, you know, we put people on blood thinners. We can give them medication to get their heart back in rhythm. Sometimes we put paddles and shock people's hearts with electricity to get it back in rhythm. And there are new procedures called atrial fibrillation ablation, where you can actually go in there and zap that AFib away permanently with electricity. So there are a lot of treatment options out there.
And of course, could be a lifesaver and could make you feel like a whole new person.
Yes, absolutely.
Wow, great information. Great to have you on the show.
Good to be here.
All right, happy
Thank you.
Thanksgiving to you.
Same to you. Same to you. Stay safe.
If you have questions, you can always call this number. Also, there is the website for the American Heart Association. Lots of information on that website.